This is Jody Tropiano, the Content Director for Health, and I'm here with Mario Schlosser, the CEO and co-founder of Oscar. Mario, thanks for joining us today.
It's nice to be here.
So we're going to chat a little bit about the COVID-19 pandemic and hear a little bit about what Oscar has been up to.
Awesome. Good.
So let's dive into
about that.
Yeah. So we know that the patient landscape for COVID is changing, seems like every day now. But what could data really tell us about this unique patient landscape?
So we've approached it in a couple of different ways. We, on the one hand, wanted to make sure that we know very quickly who is currently affected by COVID, who has symptoms, who may have had a positive test, who needs help on managing the virus right this moment. That's kind of one segment of people. The second segment of people is folks who aren't directly exposed and who aren't directly sort of like affected by the virus, but indirectly have an impact on their healthcare experience. People who can't fill their drug now suddenly, people who can't fill their medical equipment order, and other folks who may have issues around sort of like other healthcare issues they have. And the third category of people really is everybody else, everyone who's worried about what impact the virus might have on them, on their lives and their finances, and all the things that are in everybody's mind right now. I think data can help really identify and then micro targets really in all three segments. So for the folks who are affected by the virus, as the insurance company, as Oscar, we have to know very quickly who has it and how can we help right there. If you simply worry about having symptoms, we were, I think, the first insurance company who put out a symptoms checker, little tool that tells you, are you exposed? Are you at risk? Should you get tested? Where can you get tested? We had the first sort of like nationwide coverage of testing sites around where you are at Oscar as well. So for the folks in that second bucket, people whose healthcare might be affected in indirect ways, we know quite precisely as the insurance company, again, what other issues you're dealing with in your healthcare life. And we can therefore get to you proactively and tell you, hey, refill your prescription now, or let us deliver the prescription to your house instead of picking it up and so on. And for the folks who are generally worried, we are trying to kind of think about creatively the situation in life that they might currently be in and how we can be helpful there. And if you take me, myself, as an Oscar member, for example, I've got a 6-year-old and a 7-year-old. I have to make sure they don't kill each other, obviously. So like priority number one for sure. But also help them in their schoolwork and things like that. And so could Oscar be helpful there? Can we send you some helpful tips on how to, deal with the kids at home and how to educate them and things like that. So that's a bit of a broad sweep there and how we're using data right now.
Yeah, that's great. And so you touched on it a bit, the different ways that you're using this data to drive member communication, but any other kind of methods for that? And then also which methods have been the most successful to communicate with members?
So when we also are working from home and when the crisis got very serious, one thought that was in our minds right away was everyone will want to hear from people, from folks with helpful information. And so we want to be the one entity that is in your life that will have the most relevant and helpful information as it relates to the virus. And that meant to us that right away, we started thinking about all these various segments, membership base that I just kind of went through. And we try to really think about and test very, very quickly, what is messaging that resonates? What are topics people want to hear from us about? And started running at a very, very rapid pace. A lot of sort of like different targeting mechanisms and tests around messaging and around kind of helpful content there that we thought would resonate. And we found pretty early on that obviously right away, helping you understand your symptoms and then how to get tested, where to find testing and so on, that resonated a huge amount in the early weeks of March when our kind of incoming messages, our incoming calls, our telemedicine encounters started spiking right there. Deploying more telemedicine has been a huge boon. You know, Oscar has long been the insurance company with the highest telemedicine utilization. Last year, we've had about a third of our membership use our telemedicine. That doubled again this year. So kind of compared to last year, we had double the amount of telemedicine on a per capita basis throughout really March as the kind of crisis, and throughout April as well, as the crisis kind of dragged on there. And becoming more helpful in how we help you in those encounters with the virus and other issues around it was a very important other way in which we use data right away, and understanding what are those conversations about, what are the questions that people are asking in these, which segments again are coming with which questions, and looking at that very quickly. And I would say the third piece then became for the messaging areas we found, how can we shift from giving you good content and giving you good information to giving you good usability, kind of good utility, if you will. And one example for that that I think is actually quite interesting is if you take one of the segments I talked about earlier, folks who may have trouble filling prescription medication orders because they can't leave the home, because the pharmacy might even, be closed certain times of the day. My CVS around the corner here, for example, is now not open as long anymore as it used to be, as New York's in lockdown right now. We said, can we help you shift to mail order? Can we help you shift to delivery there? And one interesting data point just from last week actually is one of our secure messages, so a message to the Oscar mobile app that the members read, around the messaging of, you've got this prescription drug expiring here, you got to refill it, gets about a 50-60% open and read rates. So, a ton of members actually engaging with the content right there, and lifts the percent of people who switch to mail order in a control group with about 1.5% or so to about 4-5% of those folks who get the message and read it to then go on mail order. So with just one secure message that's well targeted, that kind of comes at the right point in time in your own healthcare thinking as a member, can generate quite a bit of behavior change in an area where there's really utility for the member. They might not have known about the fact that you can get drugs delivered on mail order, and it becomes a better experience and a more useful experience right there.
Yep, that's simple but impactful. That's great. So part of that communication, I'm sure you're kind of directing your members towards any COVID-related programs that you guys have, or maybe out there in other places. So which programs are you seeing as the most impactful?
I'd say it's a couple of things. The earliest tool we put out, as I mentioned a bit earlier, and I think we were the first insurer to actually put this out in the markets, was a symptom checker where you can click through and right away get an assessment of your risk. Have you been exposed to somebody with a virus? What are the kind of symptoms you should be looking for and listening to really with yourself? And then depending on where you get stratified there as a risk segments, we would then tell you where to go, what to do next. Talk to one of our doctors, one of our virtual primary care physicians, go get yourself tested in one of the testing sites. We have information on where they are and when they can see you and things like that. And so right there, that became a very, very powerful tool. In that tool, by the way, I would highlight one really important feature of the technology we've built at Oscar, which I think is very relevant for the rest of the healthcare system as well, certainly for insurance companies, and that is the ability to make changes quickly. It's not enough to put something out there and kind of let it sit there. You have to certainly, number one, look at the data coming back to you very quickly as well. Are people filling this thing out? Where are they dropping off in the survey? What are they getting confused by? What are they telling you beyond the kind of multiple choice questions you're getting in there? Things like that. So very quickly learn from data you're collecting, that you're getting inbounds. I think that is often not what many insurance companies even do well. I often think I'm the only insurance company CEO who can in real time pull up a dashboard and look at how everything's flowing through our systems. So that's one important point. And the second important point from a capability standpoint is to then change things very quickly. If you vendor stuff out, if you give things to kind of to other companies to run it on your behalf, you lose some ability of modifying these tools when you see new things. if you recall, it might have been the end of March or the beginning of April, the symptom that people who have the virus lose their taste, their sense of taste and smell, became a new thing, became a new discovery. It popped up and suddenly was all over the place and became kind of confirmed as a symptom there. Right away, within a couple of hours of this kind of breaking and becoming clinically validated, that became a part of the Oscar tool that we now ask you about that symptom as well. So that's an important ability there as well. So that tool, the test and location tool, was important. I talked about our telemedicine being very important as a tool as well. And I think now, as we spoke about a bit as well, the most important tool we're now using is really this ability to communicate on the outbounds with members and to test very quickly with the target group and a control group who is receiving which messaging, how is it landing, and are we engendering behavior change? Are we getting people on drugs that again might be easier for them to refill? Are we refilling their medical equipment if they got to get it refilled, et cetera, et cetera? Those are all the things we're working on right now.
Mm-hmm. That's great. And so you touch on a little bit, how other payer organizations maybe aren't doing the same thing, but for ones who are looking to implement similar programs, what advice would you have for them?
Honestly, I think the first piece of advice is study the front lines and listen to the front lines. I think that's is generally underappreciated. In the drive towards more quantifiable data, which kind of the rest of the world has been going through for the past 10 years, right? Which healthcare and our payers have woken up to recently, I would say, right? In quantifying more of your data points more quickly and not waiting for the monthly claims loads to occur before you can look at something. It's important to kind of get that done in a better way, in a faster way, but don't forget that it might still be more relevant and still be more interesting to actually just read tickets and like read, what your teledoctors, for example, might be jotting down as notes from the day and things like that. Who are the people I talked to today? What problems did they have? What have they had to navigate? This anecdotal information and this qualitative, not quantitative information, in my view, is a super important insight generation to then start quantifying stuff. You oftentimes see nuggets of insight first if you just kind of look at tickets, and then you can say, oh wow, there's a new thing that's happening here. I wonder how big that has gotten, and then you can start counting this. So an example actually for us probably is the virus. If I look at our dashboards, it was probably the middle end of February when we started seeing mentions of the virus becoming more than 5%, more than single digits of our telemedicine conversations. Yeah. And that's sort of like started slowly creeping up there. And that became a real reason for us to say, we got to build a symptom checker. We got to get some, an idea of how big this could get. We got to start planning for Oscar, how we would work from home if it came to that. Yeah. So that was a really important thing to look at. Now recently, I give you a totally random example again as well. Last week, for 4 or 5 days, the biggest source of increase of positive COVID diagnoses in the Oscar membership base came from lab tests in California, Southern California. I look at the dashboard every day, a couple times a day, oftentimes. I saw that one curve tick up there. And there is some information in there. And we're looking into now, is this sort of like, California getting better at testing? Is this a particular physician group routing better? Teams looking into what we could then leverage from that insight for other states we're in as well. So that is sort of like an anecdotal kind of insight where something's happening there systematically that you can learn from. You can maybe take it to other places of the country and get something improved and better from that kind of point of view starting there. So that's one piece of advice I would have. Study this, don't just do it quantitatively, do it qualitatively as well, and go from there.
Yeah, it's great advice. So now taking more of a macro view, how do you think this crisis really will fundamentally change the health ecosystem, maybe focusing specifically on payers and how they'll be impacted?
I think I think it's it just can't be overstated what kind of impacts this is all having on so many aspects of our lives. I think. I mean, there's a weird sort of like blankets the human mind has that it eventually will just put on top of things, right? So, having worked from home now for 6 to 8 weeks, you start seeing that blanket come down. You start sort of like getting used to everything and say, well, maybe there's a new normal here, and it's becoming normal again. And we tend to then forget still how big the disruptions have been, how big they still are, and how different life will likely be trying to go back to the old normal. And I think this applies very much also to the role payers have in the healthcare system. A couple of things are happening in my view. One is, in my view, we started Oscar 7 years ago now at this point, because I found the communication I'm getting from payers just not particularly helpful. They were these sort of like mass emails that don't really have to do very much with me as an individual. They weren't customized, personalized to the situation I'm currently in, and they weren't useful either because of that. So I don't think that's changed all that much, over the last 7 years. Actually, one hilarious thing from 7 years ago that I think has changed is one payer's Twitter account at the time. Literally, I have a screenshot from this. Used to say, tweeting about healthcare from the hours of 9 a.m. to 5 p.m. every day, every weekday. So they were opening hours on the Twitter accounts, which was sort of like a hilarious, payer-specific thing, I think. So that personalization, that micro-targeting, I think is becoming a much bigger deal. Amazon's been running sort of A/B tests on pricing in would you want to see that book or this book with this price, that price for many, many years. And that same kind of approach, I think, will have to make its way into healthcare as well. Now, healthcare isn't like retail for sure. You can't willy-nilly change prices and things like that. But there are many kinds of offers in live real-time communications and perhaps even discounts you could deliver that would really be helpful to providers and to members alike and every other stakeholder in the system as well. So personalization and more actionability around those personalizations, I think, is one important pathway. I think, the shift to telemedicine, everyone's obviously, I think, aware of that. I don't think that it'll go back to what it was before. That'll persist, that folks have gotten now used to more telemedicine encounters and will want that to be a big part of their healthcare, and we'll see that really kind of keep pushing forward as well across the system there. And then I would say the increased risk sharing in the system, this will keep pushing through the system as well. If you're earning fee-for-service right now, you have much more of a problem with elective procedures being down 30 to 80%, right? If we look at across our claims data, the drug you take in conjunction with a colonoscopy, for example, that's sort of like a nice real-time way for us to see who's right now doing a colonoscopy, is down something like 80%, or was down even since week over week when the pandemic really started getting traction in the US. Prior authorizations are down 30, 40% or so. So if you're on fee-for-service, that is very hurtful to your top line. If you're earning a premium for managing people's risk, then you're still earning that premium basically, and so that'll spur more folks on the provider side, I think, to start taking more risk. And the final thing I would say from the payer's point of view is it never made sense that we tie health insurance coverage or health care coverage to your employer. Right? It never made sense. I often used to say that we're not telling you if you leave your job to switch from an iPhone to an Android phone or whatever. Right? What does that have to do with anything? Or even worse, I'm not telling you to switch hairdressers, if you change jobs. It's like a completely different thing. Yeah. The same way, I think your healthcare coverage is something completely different than which job you're working with. Unless you're working in a coal mine or something like that, maybe then there's something specific to it that you'd want to make sure that you sort of like incorporate into your healthcare coverage. And I think when we come out of this and hopefully get through this to the other sides, the individualization of where you buy health care coverage will have changed. And I'm specifically saying healthcare coverage. I think we're going to move more and more from health insurance coverage to healthcare coverage, more narrow network designs, more provider payer risk sharing, and then a more personalized offering of what you can buy and where you can buy it. And I really think that large employers sort of like will give you pre-tax dollars and you can then buy whatever healthcare coverage you want. That's now regulatorily speaking possible. Since the beginning of the year, there's a thing called the individual coverage HRA that makes this now possible. And I think that's going to be a shift that's going to start now and not keep stopping for a long time.
Yeah, fascinating. So you touched on provider-payer relationships just a little bit, but digging further, during this time, have you had to change those relationships and how you work with your provider partners?
Yeah, we made the choice really many years ago, really back in 2014, that we would really only build more custom designed, more narrow network designs. And I remember there was a strategy offsite we had in 2014. We had our first 12,000 members. We were just in New York City at the time. We were renting a network. When you're a new payer, that's kind of something you got to go and do early on. And we were writing down at an offsite all the various components we were building and we were going to build at Oscar. We were building tools to help you find a doctor, and we were building data science to designate who are more efficient, more effective doctors. We were trying to build better ways to compensate physicians for the care they're delivering, kind of more discounts in the moments, all the things I just talked about. And so I remember kind of writing on this equation where I said, okay, this plus that plus that plus that equals, we should really try to be building more risk-sharing deals in narrow networks with providers. Mm-hmm. That took a long time to really spin up and build. We launched our first network design that we built ourselves in 2017 in New York with Mount Sinai. But since then, we did this across the country. We have a plan we built with the Cleveland Clinic called the Cleveland Clinic Oscar Health Plan. It's got a great medical loss ratio. It's got 11,000 people in it. It's working very well, I think, for both sides. We split risk 50-50. We co-brand the plan and so on. I think that's the kind of model you will see much more of from us, certainly, and I think overall in the system as well. And then I think also the big health systems they have the capital, they have the mind space to get into this. They at times also have more to lose because they have more facility spend already. They have more bricks and mortar already built out. That's just the kind of navigation they've got to sort of like thread very carefully there. But on the other hand, you are, I think, seeing more and more smaller provider practices getting into this as well. And we want to be helpful there, certainly as well. We have a lot of technology and operational capabilities we can now bring to bear that can help a smaller provider to also potentially take more risk and to actually navigate this new world of risk sharing in a better way. Oftentimes you need to start building front office services in a different kind of way, proactive outreach, more population health insights, more analytics in a way that your current front office operation isn't set up to do as a smaller provider. Those are things we have built with our concierge teams, with our internal tools, with our population health analytics and so on, that we can probably deploy on your behalf if you're in a relationship with Oscar, if you're in a network with us, and if we capitate you in a deal, if we give you risk. And so those are all things we're pushing across the country, and they're working well, and we want to do more of them.
Mm-hmm. Excellent. It's great insight. So kind of last thoughts on the pandemic and just where we'll be on the other side of this. What are you thinking? Any last thoughts or just future projections for how we'll come out of this? Hopefully better.
Hopefully better. I think the silver lining would be that there is a certain sort of like reinvigoration and rejuvenation that if you go through a deep crisis, if you have to sort of like, if you're forced to reinvent parts of your life, parts of your job, parts of your company, it's like taking a different way to work every day. It's sort of like it'll jog certain things in your mind and your brain that maybe otherwise you wouldn't have activate and reactivate again. That's how I try to look at it, really. This is a time to make more tougher decisions, to try to be more honest to yourself about what's working in your life and what isn't, to try to be honest about to yourself there, what's working in your company and what isn't, who is working in your company and who isn't, who's working out on your team and who isn't, things like that. And do this in a way that you sort of realize, what, the other person's probably thinking the same right this moment as well. And you can now really be honest and open about this in a way that maybe you couldn't do it before. If you are, there's this psychological study that I always think of, which is you have people walk over a very dangerous bridge that is shaking and just gets your like pulse rate up if you walk over it. I think this is like a Daniel Kahneman thing or something like that. And then you run sort of like an A/B tests. You have a person taking in a survey right after the end of that bridge, and the person, man or woman, writes his or her phone number on that survey on the back and sort of like waits for you to call, basically. That's the A test. And the B test is you have that same person, but 100 meters kind of behind the bridge when your pulse rate is already down. And a lot more people basically call that person back when the person talks to you and does that survey right after you walked over the bridge, because you're just in a different state of mind. You've kind of sought out the risk. Your brain is sort of like heightened awareness and all that kind of stuff, and you're more willing to reinvent yourself. And in a sense, this might be happening to us all of us right now, and that'll be just, I think, the silver lining in a sense that is not possible. Now, I think that can be a cynically sounding thing to say if people lost their jobs, if they have real income issues, and if they have to, or if they have got sick, and if a loved one died, of course. So I don't want to sort of like push that too far as a silver lining, but it's the one thing that you can sort of maybe grasp onto and say, we may come through this and all feel like this is a chance for an interesting restart and a rethinking of how things really should go and work. And I'm hoping that's what that's what many people eventually get to do once we've worked through the thick of this and gotten through the thick of it.
I like that. It's a good place to end it. Mario, thank you so much for joining us, and stay safe in New York. And hopefully we'll talk to you again when this is all over and we can see if some of those insights panned out. I hope they did.
Yeah, I'd love to, Jody. Thanks so much again. Great to see you. See you soon. Thank you.
Thanks for watching this interview. We're doing our best to keep our health community up to date and informed as the pandemic progresses. So please check back for more interviews and blog pieces with leading health experts, as well as check out our Health COVID resource page for more information. Thanks again.